Welcome to Mayo Clinic. My name is Dr. Bob Albright. I'm one of the nephrologists, which makes me a kidney guy. I work here in the Division of Nephrology and Hypertension at Mayo Clinic. I wanted to talk to you a little bit about chronic kidney disease. We used to call it chronic renal failure, but no one knew what a renal was, so we switched it to chronic kidney disease. Chronic kidney disease is incredibly common and unfortunately becoming more common in our society. This is primarily because many more of our members of our population are developing complications related to being a bit overweight, having high blood pressure, suffering consequences of diabetes, and all those issues can occasionally and often lead to blood vessel damage. And because the kidneys are essentially just a big old couple balls of blood vessels, your kidneys end up becoming damaged by the high blood pressure and the diabetes. The most recent study came out in 2008 suggests that there's at least 26% of our population that has chronic kidney disease stage 3, which is moderate kidney failure. To put that in a context, chronic kidney disease stage 3 means that your kidney function has gotten down to roughly about 50% of what would be expected. Frustrating enough, there's not a lot of symptoms occasionally associated with chronic kidney disease. And it's basically good detective work and good general care that brings folks the knowledge that they may be at risk for or even have chronic kidney disease. Folks that suffer with diabetes or high blood pressure are already at very high risk for potentially having chronic kidney disease. Your physician, your provider, would arrange for you to have certain blood tests or urine studies which would help document whether you had kidney troubles to the point where you ought to be seeing a kidney specialist like myself. Mainly what we work towards doing is understanding why the kidneys may not be working the way they should be, offering possible diagnostic tests that would allow us to sort out whether it's anything more than high blood pressure, diabetes, and then ultimately trying to do whatever the heck we can to keep that kidney function steady, or if we're very fortunate, be able to improve the kidney function by our different strategies. But there are certain medicines that aren't so healthy for your kidneys. One of the more common classes, and commonly used, I should point out, classes of drugs would be these things called non-steroidal anti-inflammatory drugs. These are things like Motrin, ibuprofen, Advil, Aleve, and some of their cousins, also known as the COX-2 inhibitors, like Bextra, Vioxx, Celebrex. Those drugs are also tough on your kidneys. Controlling blood pressure is the most important thing as far as preserving your kidney function. There are guidelines that we like to shoot for, and depending on your age and other specific issues pertinent directly to you, we'll make specific recommendations about what medicines and what levels your blood pressure should be controlled. What about exercise and diet and other habits? Well, we weren't so smart for many years. We didn't know that smoking itself was hard on the kidneys. We assumed that smoking just was tough on you because of the issues with your lungs and blood vessels, and the kidneys were sort of bystanders in that process. But now we know that smoking cigarettes is also very tough on your kidneys, and it's something that we very closely work with our patients to try to get them to come to a solution about stopping smoking. We have lots of different ways we can help you with that effort. I think here at Mayo we have a leg up on most other institutions where we focus on you as a person and as a whole rather than as perhaps kidneys. Particularly in kidney disease and maybe some other medical specialties, you can't not address the entire person's health when you're talking about kidney disease. The habits as far as exercise, your choices as far as diet, habits as we've mentioned, and taking good general care of yourself will all play a tremendous role in your ability to maintain your kidneys' health. Here at Mayo, because we all work as part of a great big team, and your medical record travels with you between all the different specialties, you have a tremendous leg up here at Mayo. Here in nephrology, since there's 35 of us practicing, we have a tremendous amount of opportunity to leverage everybody's interests and strengths from a physician perspective. We have novel education strategies not only for our trainees who are here, but for our patients. We've been doing a lot of work with group education And to some of us, that may sound a bit intimidating, but it's often beneficial to be able to sit in a room with others who have the same complaints, whose family members also are going through the same things. So thanks very much for your attention. Have a good day.